Hi, and welcome to our new vlog series. This time it's on lupus. But before we get into the story of lupus and Sharon's journey with it, I'd like to just remind you, please, to if you like this video, to like it, subscribe, and also to just click on the notification button to help spread the word to others. Thank you so much. So without further ado, let's get on with lupus. So first of all, what is lupus? Lupus is a chronic inflammatory disease that can affect many of the body's organs. It's an autoimmune disease, and that is, it occurs when the immune mechanism forms antibodies that attack the own body's tissues. Some experts believe that it is due to an as yet unidentified virus. According to this theory, the immune system develops antibodies in response to the virus that then attack the body's own organs and tissues. This produces inflammation of the skin, blood vessels, joints, and other tissues. Heredity and sex hormones are two other possible factors in the development of this illness. This disease is also said to typically affect women. Why is it called lupus? Lupus means wolf, and it's because many people who get lupus develop a butterfly rash across their nose and cheeks, which gives the appearance, a wolf-like appearance. But there are two main types of lupus. The one is SLE, which means systemic lupus erythematosus, and DLE, which is discoid lupus erythematosus. SLE is the one most people refer to when they speak of lupus, and as the name implies, SLE is a systemic disease that affects many parts of the body. DLE is less serious and it primarily affects the skin, and this is where people with the butterfly rash and wolf-like appearance, where that comes from is actually the DLE, because not all SLE patients will develop any skin issues. SLE ranges in severity from mild to life-threatening, and the first symptoms in many cases resemble those of arthritis, with swelling and pain in the fingers and other joints. The disease may also appear suddenly with an acute fever. Other symptoms can include abdominal and chest pains, blood in the urine, fatigue, hair loss, loss of appetite, low-grade fever, and many others. So again, you know, all of these autoimmune diseases, you will see there's just so many things that can contribute to it. So now we will tell Sharan Nayager's story, and I do thank her very much for being willing to give us her story. And it's been a long journey so far that she's lived with it and dealt with it mainly in a natural way. So let us get on with her story. Sharon's mum was diagnosed with lupus when she was just 38 years old. But at that time, it wasn't a well-known illness, and it took about 2.5 years for the doctors to diagnose. Once they began proper treatment, it was unfortunately already at an advanced stage, and within a period of 4 years, Sharon's mom passed on. 6 years later, Sharon, who was living in London at the time, she contracted a cold, and it was one of those that just didn't seem to get better. She got to a point, though, where she was coughing up blood, and she had severe inflammation in her joints. It was so bad that when she got out of bed, she had to go and have a shower straight away to try and relieve the pain that she was feeling in her joints. She went to a doctor while in London who sent her for tests, bloods, scans, etc. And when the results came back, she was given the diagnosis of SLE lupus with rheumatoid arthritis. Sharan was on contract in England, and she and the doctor believed that it was due to high levels of stress that was a trigger for bringing on the lupus. So she came back to South Africa and went to see the specialist who at that time specialized in lupus. It was Professor Modi. He diagnosed her mother and he confirmed, sorry, you can see my paper there, and he confirmed Sharan's diagnosis of it being systemic lupus. And also confirmed that the level of stress was a big contributing factor for triggering the condition. She has been living with this condition for the past 14 years, and right from the beginning, having seen what her mother had gone through, she chose not to go the medical route at all. She does go every 3 months for a checkup where they do the bloods and scans, naturally, because she needs to keep a check on what's happening. Her specialist and the doctor who see her at the lupus clinic have been prescribing that she goes on medication to slow the progress of the disease because there is no cure for it. Amongst the various medications that every doctor always advises the SLE patients to go on is medication to manage their stress levels. This is so that it doesn't further compromise their immune system. As we've said, the type of lupus that Sharan has is systemic lupus, which does mean that it affects different parts of her body systems. It progresses fast, and because there are no two people currently in the world who have shared the exact same symptoms, there's no proper treatment plan per se. The first line of treatment that doctors normally recommend is to go onto prednisone, the cortisone. But of course, prednisone comes with its own repercussions. And so Sharan has been researching and using alternate medication to try and stay away from this. So over the years, she has been able to see what does work, what doesn't work, and also sometimes stuff that will no longer work, and then she has to change her treatment plan. So she's had to be very much in line with her own intuition and listening to what doctors have said, but again, going along the natural treatment path. It was about 5 years ago that she came across our products and chose to use some of those as well, which we will be mentioning next week. She can't tell us what symptoms are constant in this disease, as this is so deceptive. Whenever she has a flare-up, it can present itself in a different way. And now, flare-ups are also very common with all the autoimmune diseases. There's a time of remission, and then there's a time where it flares up. Most of the time, Sharan says that it has been presenting in her joints and in her spine. But recently, it's now coming across as severe headaches and, let me just currently see here, sorry. And a loss of appetite, which she hasn't had before. So now it's affecting, in other words, loss of appetite, it's affecting her digestive system. Headaches, is it affecting her nervous system? So these are things that she now has to look into. That is her story to date when it comes to just her story. And I'd like to end her story there for today, because next week will be her telling how she has used nutrition, natural products, exercise, all of those things that have helped keep this disease in check. So thank you for listening. And again, this is a new subject. If you've got anything to add, do you have lupus? Do you know someone who has lupus? let us know. Talk to us about it. Let us add to our story so that we can help other people with these stories of alternative ways or ways that are added to what allopathic medicine has got in place. We will never say not to do allopathic. That is always a person's own choice. So until next week, where we will discuss more of the things she's been using, I'd like to say thank you for listening and goodbye.